Hello and welcome to Health Solutions with Sean and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Sean Needham, along with my wife Janet. And today on the line we have Jum Funk, who is a regenerative medicine practitioner out of Wenatchee. She's going to tell us a little bit. She's going to define that and tell us what it is. Jum, on the line, how are you?
I'm doing great, thank you.
All right. Well, why don't you go ahead and tell us a little bit about what regenerative medicine is?
Yeah, so regenerative medicine is basically when I am providing a procedure or teaching the patient how to sort of harness their own, body to heal themselves. And so in my practice, I use regenerative medicine such as perineural injections, prolotherapy, platelet-rich plasma injections, and stem cells to allow patients to heal themselves in a more natural way. And there's many things that go into trying to help a patient with regenerative medicine, but in terms of the procedures, those are the main musculoskeletal injection procedures that I use for patients.
Awesome. So that sounds like some really fancy terms. So I'm going to let Janet go ahead. Yeah. I'm going to let Janet go ahead and we can get into some of the details with that. Go ahead, Janet.
Dr. Jum, I am honored that you're on our show today because I have been following her on Facebook, and she has some amazing hobbies because I think she lives the life that she is trying to help people with. In that, she's a very active lady, and so I want you to share with our listeners some of your hobbies and also what your health journey is and how you became a naturopath and how that started before we jump into all the definitions and all the medical part. If you would please do that for us today.
Yeah, so I graduated from Bastyr University in 2007, and shortly thereafter, I did my residency in Nicaragua. I spent 13 months there, basically being a primary care physician for many of the patients there in the community health clinics as well as the hospital. And after my residency there, I went and worked in primary care in Bellingham, Washington. And shortly thereafter, my husband got really sick, and so I was able to get a position doing physical medicine in the Bellevue area. Yeah, and ever since then, I think that was around 2014 or so was when I started, or 13, 14, I started doing injection therapies. And I wasn't doing platelet-rich plasma or stem cell therapy then yet. But yeah, that was my journey towards physical medicine in general. And it's something that I love so much in terms of, procedures and whatnot. I mean, I still do like hormone therapy, for example, and a little bit of primary care, but predominantly I would say my practice is generally 85% musculoskeletal injections. So, yeah, and I work with, in terms of, yes, online, I do post a lot of photos of my dogs. I have two Rhodesian Ridgebacks, and I take them hiking often, and I live in Leavenworth. My medical practice is in Wenatchee, Washington. I do a lot of snowboarding, and I splitboard. My passion, though, is rock climbing. I do a lot of rock climbing in this area, and it's prime for it. And then I also mountain bike, which I know that, you and Sean are avid professionals, in this area that love to do it. So.
Well, we'll restate that Janet takes the green trails, so and that's scary enough for me. But so I know some of our listeners may know the difference between a naturopath and a medical doctor, but would you just kind of give us the groundwork of what might be slightly different? Because some people might lump everybody together, but I feel like there's a big difference between the two and how you approach a patient. So would you share that with us, please?
Yeah, so in terms of naturopathic doctor, we do a lot. We spend a lot more time with patients. I am a direct fee service clinic, so I am not limited by insurance, and so patients pay me, for services. And I feel that as a naturopathic physician, I used to take insurance, and I used to go through the insurance model, but I no longer do that for many reasons. But as a direct fee service, if there's a procedure that I feel a patient needs, then that's what I tell the patients. Whereas before, when I did injection therapies, that was not always the case. They have to get prior authorizations, and sometimes procedures actually a lot of the procedures that I do now, patients, the insurance companies find that there's not enough research to back it up. At least that's what they say. And so they don't allow patients to receive those services. And so as a direct fee service clinic, I'm able to do that for patients. So there's that. And then also naturopathic doctors, we also tend to really figure out the underlying cause of a patient's health issues. So, for example, if someone comes in, and oftentimes this happens in the clinic, someone will come in and they'll have just generalized pain. And so I'll check their thyroid, I'll check their hormone levels, I'll check what their diet is like, what their lifestyle is like, and then we work on that. And then if they still have specific pain symptoms, then I can use the injection therapy. So even though I do a lot of injections, it's actually your basic treatment guidelines of getting sunshine and being active and eating well, especially eating well. Those are all things that, and managing your stress level, that's another huge thing. Those are all things that, as a physician, I, can spend time with patients, whereas I think your typical medical model, it's just not the case because the doctors are very limited in their time. I think many of the doctors here maybe have 15 minutes with patients, if that. So, it's definitely an issue. And, I think that sometimes the physician is not always the one to blame for that. If they are working under a very specific model that is very, money driven. And so it makes it difficult for some of the patients to be able to vocalize, what their needs are, and for the physician to gather all the information and, do a very sound treatment plan within that 10 or 15 minutes. So I am so appreciative that I went to more of a cash-based model, a direct fee service model where, I can spend between 30 minutes up to an hour with patients and really get to know the patient. So, yeah. And we do a lot of education as well in terms of naturopathic physicians. So I feel that we have so much to give to the community. And, I think that more and more the people are more conscious of that there are other doctors out there that do allow, them to express what they desire and be able to come up with, like I said, again, sound treatment plans.
That's very interesting that you brought the time constraint up because I know I have friends that have worked for different facilities here locally, as well as patients that have, stressed the fact that, you can only be seen for one thing and that one thing only. And if the back is hurting, that's what we're going to treat. We're not going to look at your knee. We're only going to give you, so many questions that you can ask. And it's unfortunate because a lot of times, a lot of these symptoms that patients are having are related to one another. So, if we're only treating the back pain and we forget that, that their knee or their ankle or their foot or their stomach is upset or they're under a lot of stress, those things aren't being addressed. It's just that one thing. So I'm very thankful that there are providers like yourself that are able to take the time and have the time to actually spend and get to the root of what's the cause of their pain. And like you said, set up a plan together for that. So I feel like that gives the patient some more ownership of the therapy. Do you find that with your clients?
Exactly. Yeah. I mean, a lot of times, if you really listen, patients really tell you what the issue is.
Right.
they give you these little, clues. And so, I find as a physician, actually, it's kind of being a detective. It's listening to the patient and, gathering the information, but then also trying to sort of tease out what the salient points are so that you can move the treatment plan in a certain direction. So, but yeah, I mean, sometimes patients, they just don't have the time with the doctor to tell the patient, to tell the doctor, like, what their needs are or what's really going on. And so patients do get frustrated, and I hear that all the time. So, because I'm not working in that model, I feel like I am able to spend more time with patients.
So you mentioned some of the therapy that you offer. So what type of client is most likely to come to you? Is there a certain age? Is there a certain group that is attracted to your office, or what do they look like?
Yeah. So I would say that in general, I mean, I see patients with chronic pain or acute pain, period, in general. But in terms of being Wenatchee, I would say my patients are in their 40s or older. 40s, 50s, 60s, and beyond. I do see a lot of retirees. And, these are, because I am a direct fee service, there are patients that I can't see because of the financial constraints. And some of the therapies can be what patients say somewhat expensive, but, to me, it's very worth it. But yeah, if you have financial constraints, like there's just nothing that we can do about it. So, but yeah, I would say patients in their 40s or older are my typical patients. A lot of them are in the medical field, and it's a lot of active patients. And when I say active patients, they're not like, professional athletes. A lot of them are just, they were active before and then they got injured, and then now they want to be able to go out and hike and bike and travel, or, drive their RV without being in chronic pain and having to get out every hour. So, yeah, I mean, I think that where we live, it's so prime for just being in the outdoors, and I think a lot of people live here to be active and be in the outdoors, and enjoy the sunshine. So yeah, it's just most of my patients are here because they want to get back to being active again and doing what they love.
That's great. So before we head into our break, one of the things that I looked on your website is your regenerative injection therapies are to focus on repair, regeneration, and restore. So you touched a little bit on that, but basically what I'm understanding from you is that you're trying to take a more natural approach to their healing. Is that correct?
Yeah. So oftentimes, for chronic pain, so say, for example, if I come in with chronic knee pain, typically what the physician would do is they would inject cortisone, right, to basically decrease the pain. But, what I would do is use regenerative injection therapies that try to get your own immune system to mount a modulated effect to get your body to help repair the ligament or the tendon or the joint space, to basically heal itself. And so we're not, if you use cortisone too much, it's almost like degrading that tissue over time, correct?
Right,
so
correct.
What I'm doing is sort of the opposite. We're really trying to decrease pain and decrease inflammation so that the cells can actually have time and the resources to repair itself, which is why if a patient is doing regenerative injection therapies, I highly recommend that they eat well, they get collagen in their body, they are active and mobile to get that synovial fluid flowing. Yeah, there's many things to do to get the body to kind of help jumpstart that regenerative process. So.
Wow. That's super exciting, Jum. I'm excited to learn more in the next segment about some of the details of this. Great job so far, and I appreciate Janet. She is doing awesome at this interview. So we will be back in a couple minutes. Hello and welcome back to Health Solutions with Sean and Janet Needham. In our first segment, if you weren't with us, we have Jum Funk on the phone. She specializes in regenerative medicine, and she was talking about her practice and how she's a fee-for-service. And talked about how she does not accept any insurance. And if you guys have been listening to our radio show for very long, you know that we have talked to many providers that don't accept insurance, and one of the reasons why is, like Jum said, is they don't allow you to. It really puts a barrier between the patient and the doctor. And I wrote a book about this actually. It's called Sickened: How the Government Ruined Healthcare and How to Fix It. It is available on Kindle, Amazon, and right now, and you can download that book and read it. There's a 6-step solution on how to fix what's going on with healthcare. Sickened: How the Government Ruined Healthcare and How to Fix It. June, welcome back to the show.
Thank you so much.
So, Dr. Funk, I wanted to jump into these therapies that you offer because I think this is something that a lot of people aren't familiar with. And so I'd like you to explain some of the medicine behind it and how it works. So if we could start with maybe the prolotherapy for your injections, that would be wonderful if you could explain that to them.
Yeah, so prolotherapy is a huge part of my practice. And prolotherapy uses a solution, dextrose, which is a medicine, and you can use I use 15% or 10% up to 25%, depending on if I'm injecting a ligament, tendon, or a joint space. And what the dextrose does is it mounts a modulated, natural inflammatory reaction in the body to get and jumpstart your body to start the healing process. So, for example, if you go hiking and you trip and you sprain your ankle, you're going to have some inflammation, right? And that inflammation kind of goes through a normal, natural healing cascade. And when I'm injecting prolotherapy into, a tendon, ligament, or joint space, I'm actually instigating that natural healing cascade. And dextrose is very inexpensive. It's not a sexy therapy like a lot of other, expensive medications, but, dextrose can do so well at healing, the soft tissue. And like I said, it's the basis of a lot of the regenerative injection therapy. So, for example, if I'm using PRP, the technique that I still use is basically using prolotherapy technique where, I'm not just going into the joint space, but I'm also injecting the ligaments, and where the ligaments and tendons attach, is called the enthesis point. And I'm injecting in those areas as well because oftentimes microtears will occur there and will refer a lot of pain. So, the injections that I do, especially with prolotherapy, it's very comprehensive. It's not just one injection. You're injecting multiple areas. And that's why having good musculoskeletal diagnostic skills and physical exam skills is so important. And, for me, I love working hands-on. And so, the physical exam is just a huge, major aspect of care. I mean, I understand it's important to have MRIs and X-rays, but doing a great physical exam is huge in terms of going down the correct direction in terms of what treatments, I would want to have for a patient. So, but prolotherapy is like the groundwork. It's to have good injection techniques for all of the other therapies like PRP and stem cell therapy. You need to have good prolotherapy technique. And normally a lot of the physicians, and I teach other physicians how to do prolotherapy, the easiest medicine to use the prolotherapy technique with is dextrose. But you can also use platelet-rich plasma to inject, prolotherapy treatments as well. But yeah, that's the basis of regenerative medicine is prolotherapy.
So, Dr. Funk, give us an example of what you would use prolotherapy prolotherapy for injection of dextrose, like a hurt knee or whatever, and what would a patient expect as results?
Yeah, so I, for example, last week I did a plantar fasciitis injection, and typically prolotherapy procedures, I can pretty much get patients better in 2 to 3 treatments. Some patients that are really healthy and have good tissue, I typically can get them better in 1 to 2 treatments. Some other physicians say 3 to 6 treatments. I never ever feel like they have to come back that often for the prolotherapy treatments. But, if you're talking about someone who elderly patient who doesn't eat well and is inactive, they're probably going to need more prolotherapy treatment. But what can a patient expect after I do a prolotherapy treatment, for example? Sean, other areas that I inject for prolotherapy is basically any other joint, but for my particular practice, most of the patients come in, for example, knee pain, right? So patellar tendonitis, osteoarthritis of both the hip and the knee. I have partial labral tears, patients coming in for shoulder pain, and then a lot of neck instability from motor vehicle accidents. So I get that often, and then absolutely low back pain. So low back pain for many different, from disc herniations to just chronic low back pain from motor vehicle accidents. Yeah, so anywhere where people have either soft tissue or joint pain, you can use the prolotherapy technique to treat the patient.
So how does that differ from PRP treatment or stem cell?
Yeah, so the prolotherapy technique, you're injecting tendons, ligaments, the joint space. So most of the time, like before platelet-rich plasma existed, people would just use dextrose, which is like sugar water, right?
Right, correct.
Nowadays, we use the prolotherapy technique where we are injecting the tendons, the ligaments, the joint space, but now we're using a stronger medicine, which is the platelet-rich plasma injection. And PRP is where I draw someone's blood, just like if you went to the hospital and they drew your blood via venipuncture, and I centrifuge it down. I use a special centrifuge. I centrifuge it down, and I concentrate the platelets 4 to 7 times as strong as it is in your body, and I inject it into the space that I would use, the prolotherapy technique, into, the knee or the tendon or the ligament or the joint space to heal that area. And now, currently, I've been working for probably the past 3 to 4 months injecting PRP also into the nerves, into the peripheral nerves, which not a lot of people do. So, it's basically, I would say, 2 to 3 times stronger than just PRP is 2 to 3 times stronger than just using dextrose as medicine for prolotherapy. So the technique that I use, Janet, is the same in terms of if I'm injecting someone with PRP, it's a prolotherapy technique, but the medicine is different. It's the PRP. So if someone comes in and they're like, oh, I just kind of strained my ankle, I'm walking okay, but it's a little naggy, then I would suggest maybe starting off with dextrose, especially if they're generally healthy. If their pain level is a consistent, 6 to 7 out of 10, and they've had it for 3 months, and it's really affected their quality of life, then I would suggest something stronger. For example, like PRP, the platelet-rich plasma injections. And normally, yeah.
So sorry to interrupt you, but it just came to my mind that, our first response in traditional medicine is that we ice the area that they sprained or hurt, and then we give them anti-inflammatories. So are things like anti-inflammatories like ibuprofen part of this, or is that totally out of the picture? How do you approach that?
Yeah, so especially if you're doing regenerative injection therapies, a contraindication would be actually NSAIDs, non-steroidal anti-inflammatory medicines. And that's why it just kills me when I'm on, the hiking group, Facebook groups, and someone's like, oh, I'm gonna go hiking, and I'm gonna take a few ibuprofens before that. That's kind of just masking the pain, right? And when you're in a pickle, sure, you can approach medicine that way, but in general, if I'm trying to mount a modulated inflammatory reaction to get your body to jumpstart that healing cascade that it normally should be doing, and you're taking a non-steroidal anti-inflammatory, it defeats the purpose. I don't want to waste people's money. They're paying cash.
Right.
So I tell patients, no alcohol. If we're going through this therapy, it's really important that you not take, any NSAID, do not drink alcohol the 2-3 days after the injection, treatment. And if you have had a cortisone injection, to at least wait, 3 to 4 weeks after getting a cortisone injection. I get that question often. It's, hey, Dr. Funk, I just had a cortisone injection and it not work. I literally had this happen a few weeks ago with a hip patient. And so, again, they injected into his hip joint cortisone and it didn't help. And so last week, I injected the ligaments of the hip joint. And he actually emailed me this morning and said that he's better. So, again, sometimes, when you're using something like cortisone, they typically don't they just typically go into the joint space and not the other soft tissue areas, which a lot of times is the offending, it's the reason why the patient's in pain.
Right.
Yeah.
And there's only so many times they can have cortisol shots, too. I mean, there's so many side effects to those treatments that, you can't keep repeating that cycle over and over. There's eventually going to be a point where if it doesn't get better, they're going to have some other approach of therapy. So,
yeah.
That being said, when do you jump into a situation where you're going to start using stem cell treatment?
Yeah. So first, I wanted to sort of define, what stem cells are, because I think that there's a misconception amongst even practitioners of what stem cells are, what stem cell therapy is. And so the type of stem cell therapy that I used to do a lot was where I would make a small incision into someone's abdomen and take the fat out of someone's abdomen, centrifuge it down, and because there's just millions of stem cells in fat tissue, in adipose tissue. And then I would centrifuge the fat down and then add it to the PRP and inject it into someone's knee or hip or shoulder, the bigger joints, because stem cells, if you gather it and if you harvest it from fat tissue, it's very thick, and so injecting it into a smaller joint is very difficult. So anyhow, so the other way to have true stem cell is via a bone marrow aspiration, where they're taking the stem cells out of your hip joint, not hip joint, sorry, the iliac crest. And I don't do that. That's a little bit more invasive than my scope of practice. So, but the only way to get true stem cells is basically out of fat or your bone marrow. Now, there's off-the-shelf products that other physicians tout as stem cells, but they're actually not stem cells. And the FDA is very, very adamant that you not call them stem cells. So that includes umbilical cord cells, amniotic cells, and placental cells. But they technically are not stem cells, even though a lot of doctors advertise it as stem cells, because they do not have, after all of the centrifugation of all the cells, there's not as many living stem cells in it. However, they do contain absolutely strong anti-inflammatories and proteins that help the body. So they are very helpful, to help with healing and to regenerate tissue. You can do it via IV as well. I wouldn't for umbilical cord cells, but for amniotic cells, you can. Those are very helpful, and they are they are biologics that are part of regenerative medicine, but they technically can't be called stem cells. Whereas if you do get stem cells from adipose tissue and the bone marrow, those are true stem cell. And I typically do the stem cell therapy for patients that have moderate to severe osteoarthritis, for example. So when you have a lot of joint or cartilage degeneration, that is, and the patient can financially pay for it, that's a good option because it's very, very strong medicine.
So Dr. Funk, tell us a little bit about, and I might even pronounce this wrong. We were talking on the phone last week, and exosome therapy, it's not stem cells, but stimulates stem cells, correct?
Yeah. So I've been using more and more exosome therapy into my practice. And exosomes are basically, they're small vesicles. They're surrounded by a bilipid layer. They're part of your cell, and so they invaginate out of one of your cells, and then they are the mailman. They carry messages, to basically tell, the other cells, like your stem cells, to do their job, because as you start aging, your stem cells they die away. And so one of the reasons why I don't do as much of the lipoaspiration, the stem cells, taking the stem cells out of patients' fat, is that, if someone is an elderly, they're not going to have that oomph in their stem cells to get the body to heal as well. That's not with everybody, but with exosomes, you can have an effect on the stem cells by getting the exosomes to their signaling molecules to get the stem cells and to get the other, like the other proteins, to basically do their job, to repair tissue, or to make more blood vessels so that there could be more circulation to the area of trauma. They can help to build more, cartilage in that area. So it's getting your own stem cells, using an off-the-shelf product like exosomes, but getting it to help your stem cells, to regenerate your own, to regenerate and repair your body, and to restore the patency of that area that you're injecting into.
Wow, that's an education for sure. I'll tell you. One of the things, we started this radio show back in October of 2019, and I think we've had, I don't know, I think this is our 40th episode so far. Anyway, one of the things that's so nice is just to learn. I learn a lot every radio show from practitioners like yourself. So thank you.
Awesome.
Yeah. So thank you so much, Dr. Funk, for doing that. We're about ready to head into our next commercial break. You're listening to Health Solutions with Sean and Janet Needham. And just to let you know, we are streaming at AM 1470 KBSN studio out of Moses Lake. We are also on my personal Facebook page and the Moses Lake Professional Pharmacy YouTube site. We also archive all these episodes on your favorite podcast forums, so iTunes, Spotify, SoundCloud, and we just got approved for iHeartRadio. So we keep popping up everywhere. We appreciate you listening, and we will be back shortly. Hello and welcome back to Health Solutions with Sean and Janet Needham. We are on our third and final episode here on the radio show today, and you can listen to us every Monday, 1 to 2 p.m. right here on AM 1470 KBSN out of Moses Lake. We have Dr. Funk on the line. Dr. Funk, you still with us?
Yes, I'm here. Thank you for having me.
All right, so let's go ahead and go into, you talked about exosome therapy. Let's go ahead and talk about ozone a little bit.
Yeah. So one of the therapies that I have been implementing to a lot of my musculoskeletal injections lately has been ozone therapy treatment. And ozone is obviously it's O3, but the premise of why I'm using ozone is to basically provide more oxygenation to the tissues. So I'm injecting it into joints, I'm injecting it into muscle tissue, tendons, and ligaments. Sometimes I'll actually use it after I inject the patient with a B injection, like a vitamin injection cocktail, to provide nutrients to the tissues, to the ligaments and the tendons, to the joint space, but then also oxygenating the tissue with ozone. And, one of the benefits of ozone is that it's a very inexpensive treatment. But that also, aside from using it for musculoskeletal health, you can use it, you can get ozone rectally in order to help with any digestive issues. You can use it intravaginally. You can, like I said, inject it into trigger points for musculoskeletal pain. People also do it via IV. That's something that I offer patients as well. It's called major autohemotherapy, where you're drawing blood out of the patient, you're adding ozone to the IV bag, and then you're, putting the IV back into the patient's body in order to oxygenate the body systemically. And so many, many different uses for ozone. And I think that more and more you'll hear about ozone, as a natural treatment. It's been going on for many years now. And Sean, I think I told you that I think in Vegas they ozonate the water, because it's such a strong antimicrobial. So no matter if it's a bacteria or virus or fungal, it's there to fight infections. And I love that it's there to help optimize and boost your immune system as well if you get it systemically. So yeah.
Go ahead, Sean.
Okay, so tell us a little bit about. You mentioned it early on in the show in our first in our first segment, I believe, about peripheral neuropathy. So, what do you do with peripheral neuropathy, which is very, very difficult to treat? Maybe just explain about what peripheral neuropathy is, and what your treatment options are.
How long do we have, Sean? No,
exactly.
Just to be quick, peripheral neuropathy is basically when there's damage to the nerves that lie that lie underneath the skin. So I say that it's not the nerves coming from your spine. It's the little tiny leaves and branches that it's like the tiny leaves and branches that come off of the tree trunk. So if the nerves of your back is like the tree trunk, the leaves are like the peripheral nerves. And those nerves, when they are traumatized or damaged, can affect your skin. It can affect the layers underneath your skin, which are going to be your muscles, tendons, and ligaments. So one of the newer treatments that I've been using on patients is using platelet-rich plasma injections. Platelet-rich plasma to use to inject into specific peripheral nerves. And so if someone has peripheral neuropathy, for example, idiopathic, meaning they don't know why they have deterioration of the nerves, I will inject the platelets into their the nerves of their lower extremity, and patients are getting better results. And so what typically happens is, it's extremely painful after the first injection because those nerves are already they're damaged, and there's a lot of numbness and tingling, which are some of the symptoms of neuropathy. And patients can have peripheral neuropathy because of they have disc degeneration, and it pushes on having that severe disc degeneration pushes on the nerves that are coming out of the low back, and that can cause the nerves to deteriorate. It could be from if someone's having cancer treatments and, they're having radiation therapy or the very strong chemotherapeutic agents, then sometimes that can damage the nerve tissue. Or, oftentimes it's actually a lot of the diabetics have peripheral neuropathy. And that actually, sure, I can inject, but if I don't work on their diet and their lifestyle and getting their blood sugar managed, I'm not doing the patient justice if I'm not working on the diet and lifestyle first. But yes, if someone has peripheral neuropathy, there are treatments like PRP injections into the peripheral nerves that can help basically regenerate that nerve tissue. Some clinics use actually stem cells to inject. I typically will start off with the PRP, the platelet-rich plasma first. And then move up to stem cells if I need to. And normally patients get, good results in terms of more healing into more better circulation, so their feet or their legs won't be as cold, and their sensation tends to improve. A lot of patients don't get 100% improvement, but if you've ever had any nerve pain before, you know that even if it's 30% improvement, it's pretty spectacular if it's even 30 to 50% improvement. So, yeah. And then I do perineural injection therapy, which is basically injections of either dextrose or PRP into the peripheral nerves. And I've had great results for treatments for chronic headaches and migraines, especially after motor vehicle accidents for patients. And so I do injections of the PRP into the peripheral nerves that supply the circulation to the neck muscles as well. So many different types of areas that you can use the perineural injection therapy for. Because, I mean, our nerves are everywhere, right? And so sometimes when patients say they have pain, what I'll do first is actually do the work the nerves. So I'll do perineural injections. And then if the pain is still there, then I'll go to the deeper tissues like the tendons and ligaments and use prolotherapy in order to treat the patient. So oftentimes it's a tiered treatment program that I put patients through because, perineural injections are more cost effective. And oftentimes I can actually get patients' pain level to decrease significantly with just doing nerve injections, the peripheral nerve injections. And even though I teach perineural injections and also prolotherapy, my baby is like the perineural injections. I love doing it so much because the results are pretty much, patients will know whether they're better or not in office, whereas prolotherapy, patients will know several days later whether the treatment is helpful or not or where the treatment's going. Whereas perineural injections, they typically will know while they're in the office with me because that's how quickly you can get those nerves to kind of decrease the inflammation.
So I'm kind of hearing an underlying thing behind all these treatments. Diet still is extremely important because, there are foods that cause inflammation as well as certain activities. We've talked about diabetics and not having their sugar under control. And I'm sure that's true of other disease states that when it's inflammatory, anything you can do on your own at home to, whether it's restricting certain foods. So I'm sure you're addressing those things along with this treatment plan, correct?
Yeah. Yes, absolutely. And sometimes patients get frustrated. They're like, Dr. Funk, why do I need to check my hormones? Why do I need to, why are you spending so much time on diet and what I eat and how much I poop? And it's so important because if I am providing regenerative injection therapies to the patient, it's their own body's healing mechanism, right? Sure, my technique and the physician's technique and where they inject and how they diagnose, that is super important. But more important is whether their body is going to accept, if I'm drawing blood out of you to spin down that PRP, the platelets, the platelet is only as good as what you put in your body and, your stress level and, whether you're exercising, because more exercise means more oxygenation, better testosterone levels. I mean, there's so many reasons why having an optimal diet and lifestyle is only going to help when you're doing regenerative injection therapy. And I would have to say the other thing, Janet, is biomechanics, right? If someone is, has really bad posture and is not active and has not very much muscle mass, the regenerative injection therapy is not going to be as helpful or as efficient. They're probably going to need more treatments to heal something versus if they do have some mass on them and have good muscle tone, because if you don't have good muscle tone, I mean, your joints are held up by these, the tendons and the ligaments are just kind of hanging there, in the joint space. So I really try to get patients, and I do a lot of biomechanics assessments. My biomechanics assessment is at least 20 minutes, just seeing patients' posture and figuring out what muscle discrepancies and dysfunctions they may have, because I think that a lot of times just educating the patient on what they can do with a lacrosse ball to relax some of these muscles, to optimize the healing is really important on top of all the diet and lifestyle stuff. So.
Right. It can be just as important as the right shoes they're wearing too, which I've found out over time in the industry that Sean and I work in, the proper fit of the right pair of shoes and arch in your foot. So there's a lot of little things that go into it, which leads me to say that you can't do that in 15 minutes with a client. I assume it takes...
No, some patients, yoga is great for, and other patients, yoga is not going to be good for. I mean, if they have tons of ligament laxity and they're just overstretching themselves in a yoga session, like that's doing them more harm than good. So there's a lot of education, and And I think that as a naturopathic doctor, one of the great things about being a naturopathic doctor, and one of the tenets is docere, which is, basically doctor is teacher. And so I find that that's one aspect of medicine that I love so much, is being able to attend conferences and go to webinars and learn the new and exciting things, and then being able to educate patients on, the latest treatments or what they can do to optimize their health and healing, what herbs might be better, best to optimize their immune system. So even though I, let people know that I'm a regenerative medicine specialist and I do mostly musculoskeletal medicine, the other aspect of care I do pretty much on the daily to almost every single patient.
So you put tools back in their toolbox.
Yes. Yeah, and empowering and educating the patient, so they know, is so important. Yeah, and darn it, I have the time to do that, so I will.
I love those terms, empowering and educating, because that is our motto here. We empower and educate consumers so they can make their own individual health choices. So in about 40 seconds, Dr. Funk, wrap it up. What's your parting words, and how do we get a hold of you? How do patients get a hold of you?
Yeah, so, well, thank you, Janet and Sean, for having me on the show. I appreciate it so much. I love the community. I practice in Wenatchee, Washington. The easiest way is to call me at 509-763-9716. Also, you can email me at info@funkregenmed.com. Like I said, I specialize in regenerative injection therapies, a lot of musculoskeletal, but I also do injections, for hair restoration, for facial, for vaginal, and sexual health injections as well. I do lots of things, hormone therapy. But yeah, it's lots that I do. So if there's something that you're interested in, just give me a call and we'll have a consultation.
Awesome. Love it. Nice chatting with you. We will talk to you later. You've been listening to Health Solutions with Sean and Janet Needham.